The study aimed to investigate the association between ultra-processed food consumption and cardiometabolic risk factors in almost 1,500 children aged between 3 to 6 years old from the Corals cohort from Spain. The results basically showed that children who consumed more ultra-processed foods had higher levels of adiposity parameters, such as BMI, waist circumference, fat mass index, and also fasting plasma glucose. And also, children who consumed more ultra-processed food had lower levels of HDL cholesterol, which is the good cholesterol in their blood. And also, we saw that when substituting 100 grams of ultra-processed food with 100 grams of unprocessed food, it was associated with lower cardiometabolic health indicators, such as BMI, fat mass, and fasting plasma glucose. I want also to note that the clinical significance of this association may be considered of limited clinical relevance, but it is important to note that when we saw this association with glucose and HDL cholesterol and the adiposity parameters at such a young age, it is very important to take them importantly, because if we saw these associations at such a young age, implications later in life may appear. The associations between ultra-processed food and an increased risk of cardiometabolic diseases have been long reported in studies, but with adults. For this reason, our study is important because we assess these associations with children. In addition, our study is important because it provides new insight into the relationship between ultra-processed food consumption and its potential adverse health effects at such a young age. It highlights the critical role of early dietary habits and patterns in shaping the future of cardiometabolic health outcomes in the future. In the study, we also saw some disparities in ultra-processed food consumption. Children of mothers with lower education level and lower socioeconomic background tend to consume more ultra-processed food, and they make them more prone to future health problems. That's why I really want to emphasize that we need to make some actions, and especially public health initiatives, to help vulnerable populations. Some people are making some initiatives for public health, such as the logos, the front of pack labeling systems that has been proven and validated to help consumer make healthier food choices. However, they need more validation because sometimes front of pack label system cannot take the whole dimensions of food. For example, it may take the nutritional dimension of food, but maybe there's some discrimination in ultra-processed food products. That's why I think public health should ameliorate the front of pack labeling system, because it has been proven to help children to make healthier food choices. The study is a cross-sectional study, and therefore we cannot be absolutely sure about the cause and effect relationship. That's why further prospective and longer period of follow-up are needed to validate our results.